And one company is being proactive to help the millions of people who may suffer from hearing loss in their lifetime. The trial's underway, and hear from one sports magnate joining in on the fight against hearing loss. Scripps News Live starts right now. A potential breakthrough to help people with hearing loss. The trial's happening now at Envoy Medical and its acclaimed implant. Envoy Medical, a hearing health company focused on providing innovative technologies across the hearing loss spectrum, is focused on adding another fully implanted cochlear implant. Currently, it's the only company in the world that has successfully gotten a fully implanted hearing device approved by the FDA. It's called the Esteem, and now it has another device called the Acclaim in trials. Joining us live now is an investor with the company, Minnesota Timberwolves and Lynx owner Glen Taylor. Glen, thanks so much for being here. We appreciate it. You are a self-made billionaire. You've made a few good business decisions in your day, and you've put a lot of your own financial resources into this company. What made you decide to get involved and support these devices?
Well, I'll give you two reasons. First of all, my wife and I have done many mission trips around the world, and we've gone to schools where children could not hear or had very poor hearing, and worked with these children to try to better their lives. So that was the first part, that we just understand the need. The second part is that I had the opportunity to work with some really bright young people who worked on another project for me and came to me and said they thought they could do this. And I just believed in them and trusted them and told them to go ahead, and I would support it. And I knew it was going to take me 5 or 6 years of support, but we went ahead.
And there are more than 1.5 billion people worldwide with some type of hearing loss, in their lifetime. This could really help a lot of people. Glen, Envoy Medical recently introduced the Hearing Device Coverage Clarification Act, where the company is seeking to clarify that fully implanted active middle ear hearing devices are prosthetics and not hearing aids, and therefore they shouldn't be excluded from Medicare coverage. So what's the difference between these implants and hearing aids?
Well, we are working with people with more severe hearing loss that hearing aid cannot take care of. So we don't duplicate a hearing aid, but we do work with people that are beyond that and have difficulty hearing, and this device can get them back to normal.
How meaningful has this experience been to you, been for you rather? You've obviously had a storied business career. You've made a lot of great investments, a lot of good business decisions, especially in the sports world. But now you're, dabbling on the health side. So talk to us about this personal connection to all of this for you.
Well, first of all, I'll say my wife is a nurse. That'll help you a little bit to understand it. But I think that I've been very fortunate in my life to done very well financially, and to give back. This is just one of those ways that you can give back to the society by helping people who are less fortunate. And it just is something that came in my path, and I took it on, and I just think it's the right thing to do, and I'm very proud of it. Plus, now I've talked to some of the people who had the devices put in, and it has changed their lives completely, and this makes me feel good.
I want to bring Brent Lucas, the CEO of Envoy Medical, into the conversation now. Brent, the Esteem device has been approved. Break down how that works, and what kind of feedback have you received from people who use it?
Sure. The Esteem is a fully implanted active middle ear implant. So it is different from anything else that is currently on the market. What it does, the real elegance of the device, is that it picks up sound that enters the ear. We actually pick up the vibrations of the ossicles versus we don't use a microphone, for example. So we're actually using the ear to pick up sound, which really allows for some quite interesting benefits. And a lot of our patients who have been implanted with this device report hearing more of a natural sound and really enjoy that they're not tied to an external device. So once the sound's picked up, it is processed, and then we mechanically drive the stapes, and that it pushes on the cochlea. So you get a direct drive of the cochlea through the device.
And you have the Acclaim in trials now. What's the difference? What's different with that device?
Sure. The Acclaim is a cochlear implant, and it's, we think, probably going to be the first fully implanted cochlear implant. So cochlear implants have been around for 30, 40 years, but they've all been partially implanted, meaning there's a big thing on the side of your head that picks up the sound and then transmits that inside. Ours will be completely fully implanted, and then we'll also be using the sensor that we used with the Esteem. We'll be using that sensor, which will allow us to pick up the sound and, again, use the ear. So if you want to put something in your ear, I'm using my AirPod today, for example. With our fully implanted devices, you are able to put things in your ear to pick up sound versus having to rely on an external microphone. And we think that's going to bring some pretty interesting benefits to the patients.
Yeah, I know this could help a lot of people, Brent. I'm curious, though, what's the cost for all of this?
A cochlear implant, typically Medicare will cover a cochlear implant at about $42,000. The Esteem surgery and device is $25,000. So we are looking, obviously, at getting this covered. It's not a hearing aid. We think it should be covered by insurance. And we found some politicians who agree with that and are willing to work with us. So we got that bill introduced that you referenced earlier. We're also looking at getting a Senate companion bill introduced and hopefully get this resolved. But one of the things I would say is the cost of not doing things for people's hearing are far greater than paying for the device. When you don't treat your hearing, you have other health issues. It's been well established: depression, social isolation. There's even a link now to early cognitive decline. So the costs to society are much higher by not doing something than they are by doing something.
And Glenn, as we wrap things up, want to bring you back in. What's your vision for this company moving forward?
Well, I think it's one that can grow greatly. There's just appears to be so much demand, and we're hearing from people that just say, get the product out here so as soon as you can, because we need it. So I think it eventually will be a large medical company.
Minnesota Timberwolves and Lynx owner Glen Taylor and CEO of Envoy Medical Brent Lucas, thank you both.